that OneCare serves is as the receiver of the federal dollars and distribute. It's a pass-through organization. Now, because of the way they do their budget, I have not, over the past few years, been able to identify how much it costs to be a pass-through organization. So the 4.3 may be high. Doing nothing is unacceptable to me personally. And I think the lower figures that we've been talking about don't recognize that we're not taking money out of healthcare with this decision. We're redistributing. We're moving money out of administrative expenses and potentially moving it into programs that have demonstrated effectiveness. And I'm struggling with our reluctance to do that. So I'm not stuck at 4.3 by any means, because I don't know that we can arrive at a perfectly identified number. So I'm open to compromise. And I appreciate you listening to my arguments.
Let's do two things. And I think there's some staff and folks that have hard stops today, and I want to be mindful of that. I think it's around 4:30 that we have a hard stop, I think. Why don't we take up what seems as though we can agree upon at this time, which is the first motion and the last motion. And I think after that, since we've published the motions, the motion language, and I guess we're not sure if we're going to make the second motion or not, but perhaps we can take some public comment, and that might assist us in thinking about these issues. Russ, if I take public comment now on the motion that's published, the second motion, do I need to take another round of public comment if that's the same motion that ultimately gets made, or if it ends up being a different motion? Let me do this, Russ. That's probably legal advice. Let me just do this. I'll ask for public comment as to what we're working on, and I can ask you that question in the break. So I move to modify OneCare Vermont's fiscal year 24 budget by requiring OneCare to increase its Medicare risk corridor from 3% to 4%, with OneCare Vermont holding the additional risk of shared losses using its net assets as risk mitigation, and for OneCare to update its settlement policy to reflect additional potential upside consistent with the board's discussion today.
I'll second.
All those in favor say aye.
Aye.
Oh, wait, sorry. I forgot. Yeah, you got me, Russ. Thank you for the second, Robin, and I will turn into the healthcare advocate for any comment on that motion.
Nothing from us, Chair Foster.
All right. And Mr. Berman, the CEO of OneCare, do you have any comment on that motion?
I do. Thank you, Chair Foster. And thank you for the opportunity to speak. The Vermont all-payer model specified that the Green Mountain Care Board work in collaboration with Vermont ACOs to achieve the goals set forth in the agreement. Feel sometimes from the discussion that's going on here, we've lost some sight of what those goals are, but I'll get back to that. It makes sense that our shared desires for the ACO to partner with local healthcare providers to transform Vermont's healthcare system from a traditional uncoordinated confederacy to a collaborative ecosystem that focuses on health goals by providing actionable data and innovative payments that foster better outcomes for all. I think our common vision is to create a trusted, equitable healthcare system where patients and providers work together to achieve optimal health and exceptional healthcare experience for everyone in the state. I'd say in the spirit of partnership and vision, we created a 2024 budget that meets the operating budget requirements and guidance that were outlined by all of you earlier in the summer. I'm really concerned with what's going on now because the changes you're proposing are moving those goalposts out further. The guidance issued over the summer stated that the ratio of operating expenses to PHM payment reform payments, including the FPP and budgeted bonus payments, must not exceed the 5-year average of 3.25%, and that the ratio of population health management funding to the number of attributed lives must be at a minimum the FY23 revised budget amount. I think you'll all agree that in our submitted budget, we reduced the operating expenses in 2024 to comply with that guidance. The GMBC staff verified that we met that criteria with a 3.14% ratio. So said another way, we met your requirements, and now you're asking that we adjust our budget based on different, previously unknown criteria, and to make changes that are not based on any other established criteria. I just want to be clear that for OneCare, cutting the operating budget means losing essential resources needed to fulfill the strategic objectives set forth by our Board of Managers. Further, while drastically reducing our funding, or at least proposing that, you're at the same time asking us to hold more risk centrally. We weren't designed to do that. We were designed to bring healthcare providers and hospitals of all stripes together to participate in value-based healthcare contracts that seek to facilitate improved provider network performance and higher value for Vermonters. Going back to our founding 10 years ago or more, OneCare was simply just not designed to hold significant risk, and doing so is not consistent with the model that's been in place from before the APM even existed. We are, in a sense, a network of the providers and specifically the hospitals that take risk on behalf of their communities. Placing too much risk centrally on the statewide ACO as opposed to allowing it to function as designed and place risk within each healthcare service area is contrary to the entire concept behind creating accountable communities. Further, it's moving accountability in the opposite direction of the path that the state of Vermont would like to transition towards in 26 with the AHEAD model. In that model, risk is going to be held at the provider level due to the required hospital global budgets. So we'll be going backwards from that. Lastly, you're simultaneously ordering us to increase the risk corridor with Medicare, even though you've stated that this decision-making authority rests with the ACO. I just say, while you appear to be really focused on the amount of money that OneCare might be leaving on the table if we don't increase that risk corridor, I encourage you to consider the very real possibility of downside risk. We anticipate that the utilization may actually increase in 24 when compared to the prior year as hospitals seek to address the pent-up demand for services in the post-pandemic era, which I think you pointed out in the hospital budget process. Just say in closing, we're really proud of the collaborative entity that we've built. We remain committed to supporting our participant network, in particularly primary care. We agree with you. That is very important. That's why we've built the programs we have, and we want to scale them up and really harness the performance in 24. On the subject of risk, we'll consider how we can comply with those orders. I think we might be able to do it. But with regard to us operating below budget in past years, I think it's really important for you to note that a lot of those years were during the pandemic era. And those budget shortfalls or surpluses were due to staffing vacancies. That was common across the United States, just as people were rampantly over budget as they tried to supply things that weren't previously needed before the pandemic. And I want to be clear that we've already addressed that by reducing the budget in 2024 substantially. So if you move those goalposts out further with regard to our operating budget, it's really going to cause problems. And we ask you to reconsider these budget orders and do the right thing for the healthcare system of Vermonters and approve the operating budget as submitted. We can work with you on the risk front, but I want you to be really thoughtful about what it's like when you're asking us to take increased risk and try to get these programs scaled up to the level you're asking and drastically cutting our funding at the same time, and whether that's really the right thing to do. So again, I appreciate the opportunity to comment, and I appreciate this is a difficult decision. I thank you for your thoughtful approach to it.
Thank you for your comment. Is there any other public comment? Okay. All of those in favor of the motion, please say aye.
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 Aye. And the motion carries unanimously. Could you put up the third proposed motion language? I move, sorry, go ahead, Russ.
Sorry, before you do that, the motions that were set out were kind of contemplated sequentially. So, if you think that the board is coming back to the second motion, you may want to adjust this motion to just approve the conditions, the other conditions,
I see.
and not
yeah,
and
I
not have
see.
it. And because this was kind of meant to be kind of a summation of the whole, and so you may want to save that for the end.
I see.
Can I ask a quick question? I'm sorry, Owen. Are
please.
there any conditions that are tied to the cut in the operating expenses that should not be voted on prior to that motion being approved or disapproved?
So I think there are a couple of conditions that say that refer to operating expenses as adjusted by the board. I think I would have to go back and flip through those slides to be able to answer that question completely.
Let's do this, Russ. I go back. Just I want to keep an eye on the time, and I'd really love to be able to hopefully get this done so that OneCare can take the next steps if there are any. So what I'm going to do is I'm going to make this motion. I'll see if there's a second, and then we can take any additional public comment, and maybe that helps us think about it. So I'll move to modify OneCare Vermont's fiscal year 24 budget by reducing operating expenses by, I forget the exact amount, the amount recommended in the staff recommendation in the $900,000 range, and requiring OneCare to instead reallocate that amount to population health and primary care programs that will achieve the best return on investment consistent with the board's discussion today.
I will second it.
And is there any public comment on the motion? Mr. Boris, the CFO of OneCare, please go ahead.
Thank you, Chair Foster. Good afternoon, everybody. I just want to comment quickly on the kind of over budgeting theme from today and a little bit of context and color, if I may. So OneCare was formed in 2012 by providers to help create an efficient platform to enter into value-based care arrangements. That's the direction the industry is headed, and having one central organization to offer this service to providers in Vermont and New Hampshire as well makes a lot of sense. It still does today, over 10 years later. We work very collaboratively with our provider organizations, and particularly the hospitals that fund us to develop a budget every year. And really, I think what's been characterized as over budgeting this year, to me, is actually sound expense management. We develop a plan at the beginning of the year, and as OneCare finance leader, it's my job to make sure that we are using the funds they offer to us efficiently. And if we have an expense that we don't think we critically need for a year, we will shelve it. Additionally, I also think it's important to note that through the pandemic, business was disrupted for many people and organizations, and OneCare was no exception. We transitioned from a highly active workplace with a lot of travel to a lot of organizations across the state, which in many ways was great, to a remote structure. And through many of those years, we did not know whether or not we would revert to a full in-person model again. And as the pandemic lingered on, we decided at one point to make a decision to shrink our office space and really just adopt the remote structure over the long haul. And that's the way we continue to operate today. So some of the characterizations of over budgeting are really more a factor of what happened to our world and how we operate collaboratively with our hospital funders. I'll also note that at the conclusion of every year, we present to the OneCare Finance Committee and the board the results from the budget year. And we analyze and show them a presentation of here's what we budgeted and expected to spend relative to what we actually spent during the year. And we ask of them, what's your preference? Is it to retain those earnings at OneCare Vermont to build reserves so that we could potentially hold the risk that's being contemplated here today, or return the funds back to our funding hospitals? So I just think it's important to note this is a very collaborative arrangement that we have with our hospitals to make sure that OneCare is a good and sound steward of the funds made available to us by them to support value-based care programming across Vermont. And to echo Abe's comments, I think there's a real paradox between asking the organization to take on more risk, which, as he said, I think we can work with in some ways, while also reducing the resources. We're a small business in Vermont. We don't have a huge staffing workforce to be able to integrate into every practice and organization across the state. So it's a really careful balance to take on more organizational risk with fewer and fewer resources. And again, we just like to make the point, we complied with the budget guidance intentionally. That was very intentional on my part through the budget development process. And I urge the board to really think carefully about their decision on this matter. Thank you.
Thank you. Ms. Rader Wallach, and I've been asked to introduce people if they're associated with a regulated entity. So I believe you're still the chair of OneCare, but I don't know for certain. And I hope you're doing well. Great.
Thank you. Thank you. I appreciate that. Yes, I'm here as the chair of the OneCare board. And also as somebody who's been involved with OneCare basically since its inception. And OneCare was created as a result of the Affordable Care Act, federal law. It was organized under federal law to have a broadly representative board, as is required, including having a diverse array of consumer representatives on our board. That board we take our job very seriously, and we review annually both the budget and the operations of the organization and the goals that we set as an organization. And in fact, just voted at our last meeting last week on strategic goals for the coming year. And I think you'll see reflected in those strategic goals for the coming year precisely the kind of enhanced focus on core capabilities and efficiencies that some of the board members have been talking about here today. But I want to first emphasize that we're a private organization organized under federal law. No other ACO in the country is regulated the way that we are. And I want to suggest that this is one tool in the state's toolbox, and one way that we can achieve the lofty goals that we set out to achieve 10, 12 years ago. But it's not the entirety of the Green Mountain Care Board's job, and it's not the entirety of OneCare's job to achieve healthcare reform on behalf of Vermont. And so focusing on the success or failure of OneCare, I think, is kind of taking your eyes off the ball in some ways in terms of what the overall goal of healthcare reform is. And I challenge you to find a place in the country where anyone's done better. OneCare has not been successful in all of its endeavors, but it's been a great thing in Vermont. It's achieved a lot. And so I think it's sort of unfair to equate OneCare's achievements with has Vermont achieved healthcare reform or not? Has Vermont achieved something that nobody else in the country, or frankly in the world, has achieved? So that's just one point I wanted to make. In terms of risk, OneCare as both Abe and Tom have stated, was never meant to be a risk-bearing entity. It was meant to be a means of aggregating risk so that providers in Vermont who are small and financially fragile could assume some risk, but not too much. Not so much that it would imperil their financial health and risk them going under in communities that depended on their services. But the idea was always to pass through risk to providers because that is the fundamental concept underlying the organization, that providers should assume risk, should have some financial risk for the cost and quality of the care they provide so that they'll try to improve on both of those fronts. So the idea that you hold that at a corporate level and don't pass that through to providers just is kind of antithetical to the whole underlying concept. And as Abe mentioned, also seems inconsistent with where the federal government is going in terms of their next model. I think that's about all I'd like to say, except that I think as we enter into the next phase of the all-payer model, where we have to analyze what is the federal government proposing and what's the potential impact on Vermont and Vermont's healthcare providers. I think one of the only sources of really good knowledge about this, and one of the only places where providers will be able to get together and discuss this and shed light on, is this a good deal or not, is at OneCare. So I hope that you don't discount that value, the fact that OneCare pulls providers together to discuss these things and to aggregate the knowledge of the folks who actually are on the ground, receiving money, taking risk, providing services about the impact of these models. And then last thing is, I think in terms of getting into the operational budget, I just think you're out of bounds. That's the only way I can put it. I think we complied. The board of OneCare reviewed the budget. We complied with your budget guidance, and for you to go beyond that and say, as Abe said, that you're going to now move the goalpost is not fair play, and also makes me question, why is there a board of directors of OneCare if you're going to get into kind of line item editing of our budget? Thank you, and I appreciate your time.
Thank you for your comment. Any other public comment on the motion? Okay, why don't we take we'll take a 3-minute break. Oh, sorry, Sam, I'll turn to you. I'm sorry to have not called on you. Please go ahead.
No worries. And I apologize that I've not turned on lights in my house. I'm not broadcasting from a dungeon. I just wanted to say that we support the motion, that the staff recommendation that was proposed. And I think the board knows where we stand. I mean, obviously we submitted an extensive public comment, so I won't re-summarize that, but just wanted to make that clear. Thank you.
Thank you. And thank you for submitting a comment. Any other public comment? Okay, we have a little bit of scheduling things to deal with, and I'll take a 5-minute break till 4:27. We'll come back at 4:27. Thank you. Okay, I think we can resume. And we made a couple adjustments. I think a couple folks can stay a little bit longer. So we can see if we can resolve this today or not. And we've checked some calendars. We should have a little more time. So I don't know if any other board members have any other thoughts they want to share, but I'll open it up in the event that there is.
I just want to ask the staff a question. Mr. Berman mentioned a substantial reduction in operating budget in 2024. Can you comment if there was a substantial reduction in the operating budget in 2024? My memory is there's actually a little increase compared to 2023. Oh, you're muted.
Can you hear me now?
Yeah.
I was double muted. I did look at this. I don't have the slide in front of me. Maybe Matt can pull it up or we can get it. But my understanding from the OneCare hearing on November 8th is that they presented a budgeted to budgeted look, and that is a decrease in their operating budget. We looked at an actual to a budgeted. So their actuals for 23 projected to their budgeted 24 is an increase.
Okay.
The exact numbers I don't have in front of me.
Okay. That's helpful. That's helpful. My only other comment is, I think that sometimes there's questions about what the board's role is in evaluating OneCare specifically, it seems to come up. And my impression of the funding of OneCare is that there's basically a pass-through from Vermonters or people who are paying for healthcare on behalf of Vermonters, commercial rate payers, federal payers, state payers. And I guess OneCare does mention the cost shift, so it would be commercial rate payers have a pass-through hospitals to OneCare for their operating budget. So while hospitals allocate that money to OneCare, it is really Vermonters' money that's going to OneCare. And I think that when I think about evaluating OneCare's budget, I think about our responsibility as a board to ensure that Vermonters' money is being spent in the most optimal way to meet the goals of improved access, improved quality, reduce cost, improve equity, those things. That's just my one comment on that. But thank you, Marissa, for that clarification.
Any other board members have any questions or thoughts? Right. So, I think the folks with the public comments were really helpful in sharing their views. And I think, one of them was similar with what Member Lunge had said. And I think it is more comfortable to think of it that way as an opportunity to put some of this more in guidance next year to be more prescriptive. I know the board had asked, or I think Dr. Merman had asked, or staff had asked for programmatic costs. And what I'm hearing from Dave and Tom is that you have concerns that this costs more than what it needs to. Some of these programs aren't working and we're paying for them, and you have an obligation to take care and be responsible stewards of that money in this role. And I understand that completely. And I think maybe what we could do is put in guidance next year that we need to understand those programmatic costs better and to have a better ROI on the programs. What is working and what is not working? I don't know if it's so binary as, pass through versus not pass through versus has all these programs that help really help care for Vermonters in significant ways. But I think we need to kind of drill down on that a little bit before I think we should make a very large reduction. I think we need to understand that before we do. And I think the right place to do that at this time would really be in guidance. I think there is over budgeting. I mean, it's over budgeted every year, whether it's a pandemic or not, it's more. The guidance isn't binding. There's a whole host of factors out there that are important for us to consider beyond the guidance, including the statutory factors. I had concerns about, frankly, some of the administrative costs, but also the resources for primary care and some of the public comment that was shared, and also B1D and some of what we saw in some of the claims regarding savings. I had concerns about some of that. So I would ask the board members to consider this more measured and moderate reduction at this time, and that we can take a really hard look at what's more appropriate next year. So I think what I'll do in the interest of time, I do want OneCare to have a decision today if we can, is I'm going to ask Russ to take a roll call vote. And I ask you guys to think about this. And if we can't get it, we can't get it. Go ahead, Tom.
Before we vote, would you please remind me the wording of what we're voting on specifically?
Yeah. I don't know if Marissa, you have that. Marissa, do you have the I wrote it down somewhere, but the actual dollar amount that was put up in the recommendation?
I believe it's $957,000.
I can go back to a previous slide.
Okay, well, while you do that, Chair, I just wanted to say that I understand your position and what you've just said, and I am willing to compromise. There were in the public comments, some comments made about asking to increase risk while decreasing budget, and that that created some discomfort. I like what you've mentioned about trying to help programmatically figure out how much it costs to do different things. Because on slide 16, there was nothing mentioned about risk-bearing tolerance being part of those budgeted items, talking about executive salaries, marketing, et cetera, purchased services. So it's difficult for me to just accept that argument that increasing risk while decreasing the budget is an impossible ask without knowing what is needed to take more risk. So I like the approach that you outlined a moment ago, where we could understand with a little bit more detail what's needed to take more risk, what's needed to deliver these programs, what's needed to fulfill the pass through what I think of as the essential component of the ACO. And I'd also like to say that some board members noted that they want this to succeed. I'm one of those. I'd like this reform effort to work. So with that, I'll pass back to you.
Yeah, I guess I would just say in response that any vote I make on any of these things is so that it works and that it succeeds, and that's, I think, the goal. Okay, so Russ, I think you can take a roll call vote with, I didn't have the exact numbers when I made the motion, but it was $957,245.
Okay, I'll do a roll call vote on that motion in alphabetical order. So Board Member Holmes,
Yes.
Board Member Lunge,
No.
Board Member Merman,
Yes.
Board Member Walsh,
Yes.
and Chair Foster.
Yes. Okay. can you go to the other motion? I move to approve One Care Vermont fiscal year 24 budget as modified today by the Green Mountain Care Board and subject to the conditions presented today by GMCB staff.
I'll second.
And sorry, did we have any additions or modifications that I need to flag, Russ?
I don't believe so. Marissa, jump in if I'm wrong. But I don't think there were.
I think the way this is written, it's inclusive of the ones that were new since last week. I didn't hear any motions in addition to that of things that needed to be added.
Yeah,
Right.
that's correct. So it's all it's all of what was on the slide that the slides that were walked through.
Okay, all right. So I move to approve the One Care Vermont fiscal year 24 budget as modified today by the GMCB and subject to the conditions presented today by GMCB staff.
Did Robin already second? If not,
Oh, I
will.
think I
can-
seconded.
Okay.
All right. All those in favor, please say aye.
Aye.
Yeah,
Aye.
Aye. And the motion carries. Is there any old business to come before the board? Any new business? And is there a motion to adjourn?
So
So
moved.
Then
I'll
second.
take Robin as a, all right, all kinds of movement to kill. All right, all those in favor say aye.
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 Aye. And Marissa, Michelle, and Russ and Matt and the teams, thank you. This is never easy, and thank you for a lot of really, really, really helpful analysis. Last second questions, all kinds of information. You guys did a really great job as always. So thank you very much for helping us work through this knotty and difficult issue. And have a really nice holiday, everybody. Thank you. We are adjourned.